Good afternoon. My name is Krista, and today I will be interviewing Dr. Gilberto, head physician of Oneline Beauty Clinic. So, Dr. Gilberto, before we dive into the research, I would love to know what inspired you to focus on aesthetic medicine specifically. Was there a moment or experience that shaped your journey?
Definitely, when I started to witness more precision and the capability of achieving amazing outcomes in faces, when I started to see the best physicians that do this around the world, like Dr. Di Maio, uh, like Dr. Shrift, the best in the world, and what they can do with the products. They can definitely change the confidence in people. Become my main goal to start to increase confidence in my patients. And through this delivery, we start to try to make things as the best way that we can when we start to see those outcomes and to be achievable. So we start to try to reproduce what they do in the best way that we can, and this is when everything starts to change.
In your research, you focus on particle size and shape. For someone like me, not a scientist, why do these things matter? Do they affect the result or safety?
Definitely, we are driving through safety because safety comes first. Our patients comes to us healthy, so we have to keep them healthy. And the way to do it is to respect limits, to find out what's the best methodology to do things, and definitely the best products that are available in the market.
You used electron microscopy to look the filters. That sounds super advanced. Can you explain in simple terms what you saw and why it is important?
Well, the first question was what were we are injecting to our patients, right? Because these are permanent products. The body will keep them more than 30 days. So by the FDA definition, there are permanent implants. So when we apply it in the skin, we look how our cells start to react, how our body starts to react. So one of the questions, what was in it, right? And we start to see it in a conventional microscope, in a polarized light microscope, and we start to see the shape of the most of the biostimulators, because right now biostimulators are on a fashion, and normally they are a substance that our body reacts in a regenerative path, so it can generate collagen and new blood vessels, so the tissue can become with more vitality, which shows up in more health in the skin and showing a youthful skin. You show up like a younger person, right? Like so. Right now, they're starting to fashion in this year because wrongly there is a lot of overcorrection because they are not seeing or measuring proportion in the face in some of the physicians, and these are lead to overcorrections. Also, some psychological problems in the patient, communication with the medic, with the doctor. So all of these things starts to create fear in the populations, and then biosimilar starts a fashion, and we start to research these because for us is the question is what we're injecting to our patients and how it's composed, and we find out amazing details. This journey, this scientific journey of evidence that I start to read because of this curiosity, and there I start to know about biocompatibility, which is the main reason that we are talking today, and it's how the body reacts to the product. So how the body the composition of the products is really important. There are four things that matter in biocompatibility, which is the chemical composition of the product, what it's made of. It's a bioceramic, it's a bioproduct, it's a synthetic product, and the other thing is the size of the particle, because our cells have a size, so definitely they have to share a size, and the process is they phagocytate the product, so it has to have a size to be phagocytated, right, and create the right effect of regeneration. The other thing is the polar charge, which is can be measured with special devices. And the other thing that matters too is the shape and the morphology of the particles. They have seen that the shape is more uniform and it's more homogeneous. It reacts more into collagen formation instead of inflammatory pathways. So The definition of biocompatibility itself is the development that the product suffers around our cells when it enters to the body. So seeing the particles in the microscope is really important because of the shape and because of their size. So we can measure the size and we can see how homogeneous is the shape of each one of the spheres that can regenerate a pathway of regeneration or can generate a pathway of a chronic foreign body reaction, like an inflammatory chronic reaction in the body. So this is important clinically speaking because can increase the health of the patient, and we can increase the safety by knowing that there is a more regenerative path than an inflammatory pathway. That's why we start to research that.
Thank you. You also mentioned biocompatibility in your study.
Yes.
Could you explain what it means in practice? Like, how would the patient feel the difference after the injection?
Well, the difference after the injection will be in less swelling. Definitely has to be less pain and less reactions in a long-term way. That's the proper way because normally we have response on a biostimulator in around 3 to 6 months, where our cells are stimulated to create this collagen formation. It's this growing collagen formation takes around that 3 to 6 months. So what we are trying to see is which product is safer in this stage, and definitely what are the specific things that has to have a product to be more biocompatibility. And biocompatibility, the definition is the envelopment of cells that surround the product. It has to be a layer of macrophages. It has to be a monolayer that doesn't have to have any inflammatory response or any other cells that has response. So there is a lot of studies right now doing in cultives of macrophages, so they can see how they react to these products, and that's the way that we start to see biocompatibility too.
A lot of people worry about the safety of fillers. From what you found, are there signs that one of these is safer or better tolerated by the body?
Definitely, what research shown up in these years that I get to see and read is that normally more homogeneous surface it's cause more collagenous pathways than inflammatory pathways. So yes, in the research that we found, seen in scanning electron microscopes, microspheres, we found out that one of the products has more homogeneous structure. So we believe, clinically speaking, that's a belief because the only verdict that we have to see is in the cell's reaction. But we believe, since theory finds that more homogeneous surface cause more collagenesis, we believe that one of the products is more biocompatible than the other ones because the other ones have more and more less homogeneous structure, and it's more like formatting by extensive granulose. And you can get to see it in the study. Pictures are really well described there.
Is there any connection between the filler structure and side effects like lumps or inflammation?
It can be because if the structure is not homogeneous or the size of the particle is really bigger, but the nodules are more related to the technique that it's applied in the patient normally, because this process be applied really well spread in a lower concentration. If you apply in bolus, you can create more risk of having nodules, and also depends on the immune system of the patient. Normally, nodules can be also related to the immune system of the patient. Can be another disease or another immune disease that we are not seeing, and when we inject the product, we can have nodules. Thank God, these nodules are completely easy to treat, and they can have easy treatment. So there have not been a big incidence percentage of patients that have been presented nodules. But in my case, I never seen one here in the clinic, so I've been injecting this product for years.
You studied fillers available in Mexico. Are these products also used widely in other countries? And do you think there is enough regulation or awareness around quality here?
Definitely, we have Cofeprisa, which is seeking quality. It's a new enterprise for Mexico, and it's being in a way that it's getting structured. But they definitely are researching quality, and the things are doing the best way that we can. That's why we work with the best pharmaceutical companies that has years of experience, years of research, that has the best quality products like Allergan Aesthetics that provide us with Botox, with Harmonica, and with Juvederm, which are products that has the most quality standards in the world because they're an international pharmaceutical company. So they are seeking quality in all their procedures and all their process. So that guarantees us that the quality of the products is the best one in the world. So with that, we can guarantee safety in the product, going with the pharmaceutical that has more has been leader in research and leader in medical education in this field. Mhm.
Thank you. If someone close to you asked for advice before getting a filler, what would be the most important thing you would want them to know?
Definitely, that the injector has experience, has a lot of experience, years of experience, and that you already seen results of them, or you already see some people that has treated with them, that they work with the high quality standard products with the best pharmaceutical products available, that they see what they are giving to them, that they open the products in front of them, that the doctor has the proper credentials and the proper capacitations to do injections. And for sure, you will know that by seeing how he does the assessment in you. How he started to the consultation? If he measured your face, if he doesn't, if he analyzed deeply your gestures with you, if he is really in contact with you, asking you what you need and seeing what you need and giving you suggestions and giving you the explication of what's happening right now with your face and what we can do for you the best way that we can. So I believe that those are the best tips, and always ask a lot of questions. You know, what's the worst case scenario? You have to know the alert data. So if anything happens to you, you can come back to the doctor that you are getting treated and treat it right away, because thank God and thanks to technology, these products normally are dissolvable, so all the procedures normally are reversible, and that makes it even more safe to use these products. But because in case something goes wrong, we can dissolve it. And here we have the best technology to assess that with ultrasound Doppler, and we have photogrammetry, and now we come with HIFU, which can help us dissolve also a lot of products. So we can treat complications easily. We are becoming a center of managing complication here in Quintana Roo, and we can definitely help you out to treat any kind of secondary reaction. Even if you don't get to be treated in this clinic with this complication, we treat a complication for other clinics, and we're grateful to do it. So in case you have any questions or anything about these topics or about any other topics in aesthetic medicine, we'll be more than happy to help you solve all your doubts.
Lastly, what is the biggest myth about fillers you wish people understood better?
That they don't have to be afraid of them, that they don't have to be afraid of fillers, that definitely you have to be afraid of bad procedures and bad diagnoses and bad treatments. That's why you have to search for the doctors that has experience and that they have great results. And one of the things that I will say to you that it's a key factor is that the doctor that sees you measure your face in some way. You know, you can measure it with a clipper, with a caliper, with a phi caliper, with a photogrammetry like a Vectra, like a quantifier, but do it in some way that you measure your proportions, measure your face, so you get the proper assessment and you get the proper dose. And in this way, you will never get overcorrected. You will maintain your structure to your aging process, and you will always look younger than you already are, which is the key factor here to give you more confidence in your daily activities so you can perform better.
Dr. Gilberto, thank you so much for the interview. Thank you so much for the useful information and fun facts. Thank
Thank
you.
you so much, Krista. Have a
Thank
great
you.
day.